Hello everyone, this is Snehar Shah from the Obizz podcast series. Welcome and thank you for joining us. Today is a special episode. It's very pertinent in terms of what is going on in the world. And as you know, we bring you some wisdom on health, on welfare and on business. We've done some episodes on the business side, but today we'll focus much more on health, which is of course very important with the pandemic that is going on. Today I'm glad to bring you an authority in the field. Without further ado, I introduce Dr. Amit Thakkar. Doc, thank you for making the time and joining us. For those of you who may not have heard of Doc, who has been in the media with the different government and other health institutions that are doing their bit to help us through this pandemic. Can you, Doc, take us through your background? You've achieved many things. You're playing in many different fields. So yeah, why don't you just take us through your background?
Sure. Thanks, Nehar. Thanks to your team to have me on the show today. And thank you to Radio 44 to organize this podcast. Look, like you said, I've been in the health space for now over 25 years.
Right.
I trained as a medical doctor here, started my clinical practice, worked as a doctor for about 10 years, and then went into more of management space in the health industry. So right now I define and influence health policy, work with ministries of health, medical health institutions, and provide knowledge in the healthcare industry through consultancy, advisory, and run also an investment side in the healthcare space. My flagship business was starting Avenue Healthcare,
right? Yes.
Which is a network of clinics and hospitals providing healthcare services, before venturing into other parts of Africa, where I set up hospitals and insurance business. So pretty much I've been in the healthcare industry, and that's where I've spent quite a bit of my time.
Fantastic. That's a stellar journey and a stellar career. Are you still involved with the hospitals and the clinics here?
Sure. I mean, not here particularly in Kenya, but many other parts in Africa. I managed to diversify my business interests and made a private equity deal with a company known as Obizz, which has now been taken on as a portfolio by TPG. So it's a conglomerate of few hospitals that are now under the Evercare umbrella. But having set up a hospital in Dar es Salaam, Maputo, Harare, and my interests in healthcare business across Africa are still very, very active. I converted all that into a healthcare business known as AHB, which is a Pan-African company headquartered in Nairobi.
Okay.
And so I spend much of my time doing that, besides my non-enterprise work in the Federation, where I engage with many of the government officials that you mentioned.
Right, fantastic. And in terms of your non-business work, you are the chair of the Kenya Healthcare Federation.
That's correct.
Okay, and can you tell us exactly what that institution does?
So in my journey of starting the healthcare business about 10 years into bringing private healthcare into Kenya, I realized that the policies and the regulatory environment needs to be changed. And the only way to do it was to bring together a business membership organization, where all private sector entities in health spoke with one voice. So we created Kenya Healthcare Federation, which is the health sector board of KEPSA, Kenya Private Sector Alliance.
Yes.
And we're deeply involved in advocacy, right from the NHIF, health insurance, social care, and community care. We've been working with the government to change policy so that we have better healthcare overall, not only at the national level, but also at the county level. So Kenya Healthcare Federation is a membership-based organization.
Right.
We use the same model to then replicate in Uganda, Rwanda, Tanzania, and right now we have about 27 countries in Africa that use a similar model. At this moment, I'm busy setting up the Liberia Healthcare Federation, which was launched a few months ago. Last year we did the one in South Africa.
Wow, fantastic.
So this has been the sort of a 14-15 year journey.
Right. And you are influencing, in the Pan-African footprint, so wish you good luck with that. But coming back to Kenya, Doc, you've been involved in many of the conversations at the Ministry of Health and the presidential level. And I think today will be good to explore some of the insights and see from you exactly where Kenya stands in this pandemic. Look at the successes and the challenges, and if we benchmark where we are today, it seems we're not in a bad place at all, right? So, what insights can you share with us?
Look, March 2020 was really an important month. I remember 11th March and 13th March and 15th March. Those were important dates. We realized that we had the first case.
Yes.
We announced at Kenyatta National Hospital. I was there with the CAS, and it was clear that we needed to have a strategy. We had heard about it. We had read about it. We knew that there was a global spread. The pandemic was already declared by WHO. But it was only when we found our first case that we started putting the strategy together. And the strategy in Kenya revolved around 3 pillars. It took a long time to agree on a strategy. We even had a meeting with the president at State House discussing how we will tackle this. But the Minister for Health, who was just newly brought in, Mutai Kagwe, has done a sterling job in bringing together this strategic intent to try and control the spread of the pandemic. So it revolved around 3 pillars. The first one was prevent transmission.
Of course.
The second one was prevent death. And the third pillar was prevent social harm. Now, it was very difficult because some tough decisions had to be made about preventing transmission. And if you remember, most of our cases were imported cases. When we talk about imported, the cases came from outside Kenya.
True.
And the intention was in the month of March, April and May to limit as much as possible the imported cases. And a tough decision on 25th March was made about shutting down JKIA.
Yes.
And you remember the days of the quarantine.
Yes.
When hotels were being used as quarantine centers, not only the first 14 days, but an extension of the 14 days. It didn't go too well. Not everything went well. Maybe the planning could have been better.
Sure.
The facilities should have been much better. The 2,000 odd travelers that were caught in this space of in-between the travel were not quite happy with the way quarantine was mentioned. But what that did for the 14 and the second 14 days was dramatically reduce the imported cases. Therefore, dramatically reduce the transmission in the community. It was one such strategy of preventing transmission. We started discussing sanitization.
Yes.
And making sure we have the right sanitization solutions across, making all the people aware about the benefits of ethanol-based sanitization. We spoke about physical distancing and social distancing, and made people understand that the common handshake that we already know is a great sign of hospitality in Kenya was being reduced. And that
cultural
again,
shift.
Very cultural. And it's still difficult, but we have to cope with it. And the third thing was masks. And impressively, we've been able to send this public message out about maintaining these kind of measures, mitigation measures, to reduce transmission. But the problem we had, and we still have, was the health infrastructure.
Yes.
Having the hospitals designed to manage infection prevention control.
And that was probably the biggest scare, right?
It was biggest
especially
scare.
what we saw in Europe.
True.
With the number of deaths that were happening.
Do you know everyone was literally scared to visit hospitals in those months? Even now, people are a little reluctant. In fact, the ministry wrote a letter to ban elective surgeries and elective cases. So unless there were emergencies, you were requested not to visit hospitals for elective cases. Now that's been since lifted so that we come to some normalcy in seeking healthcare. Many private hospitals started designing units that were actually out of the hospital or as annexes to manage COVID cases, like Aga Khan did.
Yes.
All right. And we needed the public hospitals to be equipped adequately to manage these COVID cases,
Right.
and to train the health workers and nurses on how to don on a PPE.
Right. And luckily, we don't have such a high instances of deaths. But if things get worse, how prepared do you think the government and nationwide we are in terms of dealing with hospitalization issues across the country?
I think it's it's a good question. I think we are prepared I would say we are at the mid-range of preparedness. Resources are a big problem. To have 300-bed facility in every county is not a small feat. And to invest into COVID-specific zones for private hospitals is not a small feat.
Right.
Not to mention that the insurance companies are not paying bills for COVID cases in private hospitals. So revenue is down and your costs are up. So our preparedness index is around the mid-level. We definitely believe that prevention is better than cure.
Yes.
The fewer patients we have that need ICU and ventilation, the better we'll cope. The number of ventilators and the number of personnel to administer this ventilation adequately is very low across the country.
Right. And do you think we are past the worst? Do you believe we have peaked?
I believe that we are at the peak. In the next 3 to 4 weeks, we shall determine the course of the COVID impact on health and economy of this country. If we continue as people to behave safely and maintain social distance, wear masks, sanitization, we shall come down the curve and will be able to recover quickly.
Right.
If we behave normally, the virus will behave abnormally with us.
Okay. But one indicator could be the level of hospitalization today, and the occupation of the ICU beds,
Right.
etc.
Right.
And we're seeing that that level is coming down.
Absolutely.
Probably a couple of months ago, there was a shortage of beds, etc. But where do you think we are now?
So we are at probably around half of the capacity that we were dealing with 2 months ago. The number of new admissions because of COVID cases have dramatically reduced. If you remember, about 8 weeks ago, you couldn't find a bed in Nairobi. We were taking patients to the nearby counties. If you remember, at the Kenyatta University Teaching and Referral Hospital, it was practically almost full. Now the number of cases that have recovered have been discharged. The number of ICU cases have now recovered, some of them. Unfortunately, a few have died. But we see a reduction in the number of cases that are being dealt with at hospital level. That's a good sign. So don't relate to the test. Maybe the number of tests that we're doing has been coming down. Yes. We probably had done up to 8,000-9,000 a day. Our capacity is probably around 15,000-20,000 a day. The availability of kits in the global supply chain market has been a major hurdle.
Right.
But with the 3,000-4,000 tests we are doing per day, our positivity rate is also coming down. So people try to connect that since we're not doing enough tests, there may be COVID cases in the community, spreading it across lots of citizens. But the fact is we're not seeing admissions and we're not seeing people getting into ICU.
Right, but also I think there's a question about the population that is being tested. Is it being done at random? If that's the case, then that could be probably a better indicator, as opposed to if people who are being tested are the ones who are already showing symptoms. Is there any science behind how the testing is done?
Look, the ministry, I must applaud them because they also put what you call cluster targeting. There were 6 clusters identified in the month of April, May, June. And all these clusters were specifically selected because that's where we saw the highest risk.
Right.
These included the transport industry, those who are at ports. You remember the KPA situation, those ones at the borders.
Yes.
Then there was a situation of the hospitality industry, so on and so forth. So I think these tests were targeted. And what it also showed that there were some specific areas where the spread was faster.
Yes.
If you remember Old Town,
yes,
and Eastleigh,
yes,
and those specific areas where the spread was extremely fast, there was a need to close down those areas,
right,
to contain the community spread. And those mitigation measures are the measures which are giving us the results that we see today.
Right. So I guess, despite the health infrastructure challenges, Kenya is not in such a bad place. Looking at the resurgence that is happening in Europe, we're seeing the tens of thousands of cases a day in places like India. Of course, US has its issues. So I guess what we've heard is that there's 4 phases the government is looking at. In which phase are we, and when do we get into the next phase?
I think we're at the tail end of phase 1,
right,
where I told you about the 3 pillars,
yes,
of preventing transmission, containing social harm, and preventing death. We're seeing those positive indicators. The second phase is to maintain a resilient health system.
Yes.
So that we don't end up getting mortality of other conditions which have been ignored. HIV, TB, malaria. So build a good health resilient system and maintain the public awareness on all the preventive measures that I mentioned. Sanitization, maintaining social distancing, masks. We have to, adopt on how to live with COVID. We stop speaking about post-COVID. Not only do we have to live with the COVID virus, but we have to understand how to live with the future pandemics.
Right.
And these kind of viruses that may emerge. So that's the phase 2.
And when do Kenyans expect the economy to open up? With the schools, the curfew, etc.
Yeah. I think that's a tough question. The National Council that was constituted by the President meets regularly.
Right.
Yeah, the CS Matiang'i, CS Mutahi Kagwe, and many other CSs like Betty Maina, they constantly have these discussions and dialogue on how this opening of the economy should be planned. And no one has an SOP about this.
Right.
Every country is specific. But with the Africa CDC guidance and the models that they've put together, I think Kenya has been very compliant with this strategic intent. So when the positivity rates are coming down, then when you open schools, it's safe. There's some scientific reason behind that. When you see that the admissions and the ICU cases are dropping, you can start opening economy and workplace. But the pressure is on, because I know that there is a lot of desire to bounce back.
Yes.
But the last thing we want is to have a backlash of an early opening. So maintaining curfew, I think, is a great idea for at least a month or 2.
Okay.
I think getting back to school in a limited manner is a great idea. And the back to school model is being worked through.
Right.
I think we should soon see that.
Because as far as publicly is known, the Minister of Education mentioned that schools may not open till January. So do you think there's hope to bring that date forward?
I think there's hope.
Right.
I think if there is science behind how the virus is behaving, then we should not make the children lose an entire academic year.
Of course.
It will destabilize them, and they will be taken back in the career advancement. So I think there is hope. I think the hope may not be physical school opening, but there'll be online curriculum that is managed more appropriately than it is now.
Right.
So education shouldn't stop, and we should give access to that training.
Okay. So there's hope there.
Yeah.
And then just in terms of the level of deaths that we've seen or rather not seen in Kenya or Africa. There's a lot of mystery around that. It's been, written about. Scientists have been looking into it.
Right.
We've seen some articles appear in Financial Times and other international publications. Any insights into that as to why? Is it because of a younger population? Is it? I think there was some link to the BCG vaccinations. Any insights you can share?
Look, Snare, that's a good question. In the beginning, we talked about climate, that we
Yes.
were in the warmer zone. Then we talked about the youthful population.
Yes.
Then we talked about the BCG vaccination. And we talked about immunity. To be honest, there isn't a scientific paper or any proof of why it may be affecting some countries less than others.
Right.
If you look at South Africa, on the other hand, you can see the number of cases there. Or if you look at even North Africa, Morocco, maybe Egypt. What's probably most likely is all these factors have a role to play. The youthfulness has a role to play. The climate may have a role to play. But I think the biggest role that has benefited us is the exposure to flu-like viruses in the past. So, we've had flu seasons in Kenya, and you've had people coming to work with flu without a problem.
Yes.
And it doesn't affect us. It's not like a major sick leave or sick off.
Right.
But in Japan, when flu hits an individual, it really gives them a few more days before they recover. So the way we've developed our immunity
Yes.
due to flu-like viruses and illnesses is probably one of the contributing factors on how we are coping with COVID, why we are getting asymptomatic cases, and why we may have a higher recovery rate.
Great. Well, we should all ride on that good luck. And then the other thing that everybody's eagerly waiting for is the vaccines. So when will the vaccines arrive in Kenya? Is there a plan for that?
Yeah, look, we have great relation with global health institutions. I am a member of the Ministry of Health Taskforce. I sit on the Ministerial Stakeholder Forum. I co-chair that forum with Mutahi Kagwe.
Yes.
And also I'm a member of the Presidential Roundtable on Health Matters.
Okay.
The global health institutions like Gavi, Global Fund, WHO, Kenya has great relations. We've already started discussing with them about making sure that Kenya is on the supply chain list.
Right.
It's going to be a race, especially once we get the approved vaccines being available throughout the world. But in terms of your question about time frame, I personally believe it's about a 2-3 year period from now that we'll get effective vaccines.
Right.
Effective means you will take the jab and it will be close to the 90% efficiency rate. Like the measles vaccine is one of the most effective vaccines we have.
Right. Okay.
Yeah. The other vaccines may range around 80%, 70%. But the newer vaccines on COVID that may come out in the beginning may not be that effective. May be available, but because we are desperate about a vaccine, they may be available and people would receive them. But effective vaccines are clearly about a 2-year period from now that we see. Is Kenya on discussing and will get the vaccines? I really hope so. Getting the vaccine is one part, but then it's not the vaccine that's saving people, it's the vaccination. We have to make sure we vaccinate people.
Right.
To get that vaccine to everyone and getting the jab effectively so that that's maintained. That's another area that is being discussed.
Okay. And what about affordability? So, where will the funding come
from?
Yeah.
There is this global movement on something known as Solidarity Fund that WHO is championing. And under this Solidarity Fund, it's those who are able to pay and those who are not able to pay should get the vaccines.
Okay.
And
so
regardless of what's your paying capacity.
Right.
Because everyone in the public health system believes that no one is safe until everyone is safe.
True.
And so the model about this vaccine in this pandemic is provide all equally, regardless of affordability. That's a nice statement. But how much of it really will pan out to be true, and who probably gets the first lot?
Right.
Let's wait and watch.
Right. Okay. And so it's good to hear that WHO is driving that fund. In the early days, especially, there was a lot of fingers pointed to WHO, and especially by the most powerful nation in the world. Etc.
Right.
What is your view on WHO?
I think Trump did not mix his words about what he felt about WHO, and he wants to probably exit that membership. Could WHO have done better? The answer is yes. There's no doubt about it. Could we have done something by December, January? Yes. But in its own institution, I think they've tried to do what it best can. Since February. They've come up to the forefront. Have they learned a lesson about how to deal with such kind of pandemics in the future? Absolutely yes. Have they learned how to be more efficient and how to contain the virus where it's supposed to be? The answer is yes. Will they do a better job before the next virus hits? I really hope so. And I think they do need to pull up their socks. There's no doubt about it. And I think they were quick on responding, a little bit late, but they need to do a better job next time.
Fantastic. Great. Doc, it's really good to learn and bring us all up to speed as to where we are with this pandemic, where we're going. Are there any last message that you want to give to our podcasters in terms of what you'd like the population to see and any other final insights you want to give them?
Yeah. I think the global movement in healthcare will never be the same again. And I think everything feels new. Everything feels reimagined. And I just want to say that being, as a Kenyan, the responsibility is yours in the phase 2. And if we take individual responsibility, we will bounce back from this pandemic as a stronger partner in the African trade organizations, in the East African bloc. I think we stand a lot to gain. We have repositioned our manufacturing industry. We have repositioned our digital industry. And I think if we continue being strong and focused, I think Kenya will bounce back as a very strong economy in 2022 and beyond.
Thank you. And on my personal front and on behalf of all the podcasters, really, we thank you for all the great work that you're doing in driving policy. It's very important, and it will be important for the future as well. So wish you the best in terms of your African-wide endeavors as well.
Thank you so much,
Thank you
Nehar,
once
and
again.
thank you to your team. Thank you.